There are nearly 400 reported cases of measles in the U.S. What are states doing? The urgency to address the issue has been far from uniform, however, with affected states more likely to take legislative steps once they've encountered a crisis. That has left I think most of the momentum, unfortunately, is just in the states that have had problems, said Health Commissioner Mark Levine of Vermont, which has pending legislation that would disallow the religious exemption to vaccines, after doing away with the philosophical dispensation in 2016. There's no problem. Take the case of Washington, one of the 17 states that allows personal belief or philosophical exemptions from vaccinations, in addition to the medical one permitted by all states and the religious dispensation that's in effect in all but California, Mississippi, and West Virginia. A severe measles outbreak linked to a traveler from Eastern Europe erupted in Clark County, on the southern edge of the state north of Portland, Oregon, in early January, prompting Governor Jay Inslee to, of the 74 cases reported in Washington, 73 have been identified as stemming from Clark County, where they dwindled from 91.4% in 2005 to 76.5%, far below what's required for herd immunity last year. 60 of those vaccinations in the county nearly quintupled for minors and multiplied exponentially for adults in the weeks after the outbreak, but, by then, the highly contagious and potentially fatal disease had taken a devastating health toll. Prevention works, and it saves community resources, said Michelle Roberts, director of Washington's Office of Immunization and Child Profile. 2 legislators from Clark County have introduced bills to eliminate personal belief exemptions for school-age children, one applying to all vaccines and the other one only to the measles, mumps, rubella MMR immunization. The first one was defeated, but the latter one, House Bill 1638, has made it out of that chamber and is now in the state Senate. In a March 5 address to a congressional committee, Washington Secretary of Health John Weisman said public health systems at every level are struggling due to chronic underfunding, increasing population size, and the emergence of new threats. We find ourselves. That was the case with California, too. In 2015, after experiencing a measles outbreak linked to Disneyland that sickened nearly 160 people, California removed the personal and religious exemptions. Now the state according to the Association of State and Territorial Health Officials, other states pondering getting rid of the personal exemption include Arizona, Iowa, Maine, Minnesota, New Jersey, New York, and Oregon. 4 of those 7, on the other hand, several states are debating bills to expand or protect exemptions, illustrating the issue's complexity and the strong feelings on both sides of it. In front of the state capitol in February, and public health practitioners like Levine fear their voices are getting drowned out by a cacophony of misinformed or ill-intentioned vaccine opponents using social media and even bots to spread their message. The long-debunked myth that vaccines are linked to autism continues to get disseminated, as does the notion that they're dangerous even when studies prove otherwise and agencies like the Centers for Disease Control and Prevention vouch for their safety. Adverse reactions do happen, experts say, but they're rare and usually mild, like a rash or fever. Still, organizations like the National Vaccine Information Center can give the impression that parents are risking their kids' lives by getting them vaccinated. President Barbara Lou Fisher said the NVIC, which she co-founded in 1982 under the name Dissatisfied Parents Together, merely advocates informed consent and does not make recommendations related to immunizations. Asked about the government's duty to protect its citizens through public health policy, Fisher said, "Are you saying that a public health law that requires a certain minority of individuals to risk their lives, sacrifice their lives, for the rest is a moral law when they're not given the choice of whether or not they're going to participate in that sacrifice? That's not immoral." The precise number of deaths linked to immunizations in the U.S. is hard to pin down, but the CDC says life-threatening allergic reactions to a substance in a vaccine happen about once per million doses. There have been 1,295 claims filed for death since the National Vaccine Injury Compensation Program was established in 1986 as a no-fault option to litigation. About 54, that leaves 599 death claims for other vaccines. Considering 50, Fisher points out more than $4 billion has been paid out by the compensation program, but according to CDC figures, 3.4 billion doses of covered vaccines were distributed in the U.S. from 2006 to 2017, and 4,250 compensated claims were adjudicated. That comes out to nevertheless, Fisher says the anti-vax movement will continue to grow, and she sees it as part of a fight for civil liberties. Today everybody knows somebody who was healthy, got vaccinated and was never healthy again, she said, and that's the reason this issue is not going to go away no matter what kind of laws and no matter what kind of censorship is applied. Nate Smith, director of the Arkansas Department of Health, is among the NVIC's many critics, calling it an anti-vaccination group and saying part of what makes organizations like it dangerous is they can appear to provide legitimate information. Sometimes they present things in ways that are very reasonable, but then other times they make statements that are patently false, Smith said. So it's very different. Like other health officials, Smith acknowledges vaccines are not 100% safe or effective. They come with minor. Moreover, inoculation certainly beats the alternative. Before the measles vaccine program was introduced in 1963, 3-4 million Americans contracted the illness every year, and about 500 million died. The MMR vaccine, but measles is still a scourge in other parts of the globe, killing 110,000 in 2017. Mostly children under 5. The World Health Organization said. The disease gets transmitted through droplets from the nose, mouth, or throat of an infected person, and the virus can linger in the air or surfaces for up to 2 hours, spreading to 90% of people who are not immune and are exposed to someone with measles. Vaccines have made a major dent, preventing an estimated 21.1 million deaths between 2000 and 2017, according to the WHO, which points to an increase in child inoculation rates from 72% to 85% as the reason. That's why medical practitioners are so adamant about the importance of the MMR shot, despite the possible side effects. Allergic reactions can occur to any medication, any food, any substance the body comes in contact with, Smith said. Obviously, as logical as his argument sounds, Smith recognizes the political climate in every state. Vaccine policy is not determined at the federal level. Plays a significant role in what laws are enacted regarding inoculations. With no reported cases of measles in Arkansas this year, he said momentum has not built up to remove the state's philosophical and religious exemptions. But as they peer across the national landscape, Smith, Levine, and their colleagues express concern that it's not just infected travelers coming into the country who present a danger, but also the growing communities of unvaccinated people, who have helped breach the wall of protection immunization provided. What would happen if states opted to make vaccines voluntary instead of mandatory? I think the answer to that has revealed itself already with this epidemic of measles, Levine said. If you allow This article originally appeared on USA Today.
Raindrop, drop top smoking, no cooking the hot pot. Fucking on your bitch, yeah, that. Looking up, open the park.